Our goal is always to help you find the best value in Medicare coverage. Many changes are coming to Medicare in 2023 that may affect your coverage and your costs. In this video, we're taking a look at the Medicare changes for 2023, so you'll know how these changes will affect you and be prepared for the annual enrollment period between October 15th and December 7th, when you'll see these changes implemented in the new 2023 Part D and Medicare Advantage plans in your area. By the end of this video, you'll know how the changes for Medicare in 2023 that have been announced already will affect you. And just as important, I'll tell you what to watch for in future months as even more 2023 Medicare rules and costs are announced. Hi there, I'm Tabitha Moldenhauer, Medicare Plan Broker with Benefit Consultants Midwest. If you haven't already, please take a moment to hit the subscribe button. We have educational content on all aspects of Medicare, both for those who are turning 65 soon and for people who are already on Medicare. Enrollment period changes. Initial enrollment period. First off, there's good news for anyone who will be enrolling in Medicare in 2023. For most people, the first time you're eligible to enroll in Medicare is during your initial enrollment period, which is a 7-month window surrounding your 65th birthday. 3 months before your birth month, and 3 months after your birth month. The chart here shows how the initial enrollment period works through the end of 2022. If you apply for Medicare before the month in which you turn 65, your coverage starts the first day of the month in which you turn 65. If you wait to enroll until the month of your 65th birthday, your coverage will start the next month. But look what happens if you wait to enroll until months 6 or 7 of your initial enrollment period. As the system is set up now, you do not have coverage starting the month after you apply. You have a penalty delay of coverage built in. Starting in 2023, that delay is going away. So if you wait to enroll in Medicare until those final months of your initial enrollment period, your coverage will start the first day of the month after you apply. No more delay in coverage. General enrollment period. This enrollment period doesn't affect many people. This is for anyone who missed their entire initial enrollment period, which doesn't happen very often. But if you miss your initial enrollment period and want to enroll in Medicare later, you do have to enroll during the general enrollment period. Here's how that works right now. You enroll in Medicare between January 1st and March 31st. Then your Medicare coverage starts on July 1st. That delay is also going away. Starting in 2023, the general enrollment period will still be from January 1st through March 31st, but your Medicare coverage will start the first day of the month after you apply. If you did not have creditable health coverage and waited until the general enrollment period to apply for Medicare, you may have late enrollment penalties, but you won't have to wait months and months for your coverage to start. There are also some new special enrollment periods being created in 2023 to assist people who have been affected by exceptional circumstances. There is a link in the description of this video to more information on those special enrollment periods. If you are eligible for Medicare due to a disability before age 65, your situation is different. Please see the video linked above for more information about your enrollment periods. Changes in Medicare Part D vaccine costs to you. Medicare vaccine coverage is a bit confusing. Some vaccines are covered by Medicare Part B and others are covered under Medicare Part D. For the vaccines covered by Medicare Part D, currently you run those charges for the vaccines through your Medicare Part D insurance. If you have a deductible for the year that you haven't met yet, or a copay or coinsurance amount for that particular vaccine, then you have to pay that. Beginning in 2023, there will be no cost sharing for adult vaccines covered under Medicare Part D. That means that your Part D covered vaccines will cost you nothing out of pocket. For this benefit, you do have to have Medicare Part D coverage. If you decided not to take Part D, then you can't take advantage of this vaccine benefit unless you enroll in a Part D plan. The most common vaccine that this change will affect is the shingles vaccine. On most Part D plans, the shingles vaccine has a significant copay, so this change will be a significant savings for anyone who needs the shingles vaccine in 2023 or following. Insulin cost sharing limit of $35 per month. There's already a program in place that some Part D plans participate in that limits insulin copays to $35 per prescription per month. Beginning in 2023, that will be expanded to all Part D plans and insulin covered under Medicare Part B. That means whether you use syringes or an insulin pump, you will have that limit of $35 per prescription per month for insulin. Medicare Part D 2023 projected basic Part D average premium. The basic Part D average premium is not necessarily the premium that you pay to have Part D coverage. This number is released every year by CMS to give Medicare beneficiaries a very rough guide to the direction Part D plan premiums are going in the new plan year. In 2022, the basic Part D average premium was $32.08 per month. The 2023 basic average premium is $31.50 per month. That's a slight difference that may be reflected in your plan options for Part D coverage in 2023, but it doesn't mean that your current Part D plan is going to lower its premium. This number does affect those who have to pay the Medicare Part D late enrollment penalty. For more information on how that penalty is calculated, please see the video linked above. Medicare Insurance Plan Broker Agent Communication Changes. Two big changes are coming October 1st, 2022 that will carry into 2023 regarding your communication with your Medicare plan agent or broker. The first change is that all phone calls between you and your Medicare agent or broker that discuss Medicare Part D or Medicare Advantage plans have to be recorded and kept on file for 10 years. The larger call centers for Medicare plans have already had to do this for years. Starting October 1st, this rule is being expanded to independent agents and brokers also. The other change is that an extra disclaimer will need to be said verbally in the first 60 seconds of any phone call, and it must appear on all websites and written communications. Here is the disclaimer. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-Medicare to get information on all of your options. We all have to follow the rules, and we will, but that wording is a little odd, so I want to clarify a few things. First, Medicare.gov is one of the tools that we use when we are comparison shopping with you. Also, the other tools we use to compare Medicare plans allow us to show all the plans that exist in your area, not just our contracted plans. So we're never hiding any available plans from you. We contract with most Medicare plans. There are some insurance companies that don't sell their plans through independent agents, so we can't be contracted with those. In the rare instances when the best plan for a Medicare beneficiary is one that we don't have a contract with, we tell the beneficiary that. Honesty is the best way to do business, and it's why we've been in business for over 45 years. Also, the rule says that even if you call me after your enrollment to ask how a new prescription is covered by your plan, or see if some other dentist in town is in your plan's network, I still have to say this disclaimer in the first 60 seconds of the call, even when you're clearly not shopping for a Medicare plan. There is some hope that this disclaimer will be changed in the future to just make more sense, but for now, this is what we have, so this is what we will work with. Medicare 2023 changes still to come. The big one to watch for is the 2023 Medicare Part B premium. Between 2021 and 2022, Medicare Part B had its largest premium increase in history. A lot of that increase was due to a new, very expensive Alzheimer's medication that has since not really lived up to expectations. Will CMS decrease the premium for 2023? Keep it the same? No one knows yet. I have a link in the description to the most recent press release from CMS regarding Part B premiums, but don't expect those final numbers for 2023 to be released for at least a couple more months. Other 2023 Medicare information to watch for includes IRMA, the income-related monthly adjustment amount for high-income individuals on Medicare, Medicare Parts A and B, deductibles, copays, and coinsurance. And one of the most important for you, specific plan changes to your current coverage. You will receive this information in the next 6 weeks or so in your annual notice of change document from your current Medicare plan. This will tell you how your Medicare Advantage plan or Medicare Part D plan is changing for 2023. If any of those changes will negatively affect you, You will definitely want to compare your current plan to other options available in your zip code during the annual enrollment period between October 15th and December 7th. Have questions? We can help. For answers to your specific Medicare questions and to objectively compare all available Medicare coverage options where you live, please feel free to give us a call at 877-312-1414 or schedule a free, no-obligation Medicare plan consultation using the link in the description. Our services are always free, and enrolling through our office does not increase the cost of any insurance purchase. Have a great day.